Hi, I'm Joe DiMatteo of Len and Joe, Ask the Pharmacist Broadcast, Pharmacist, Clinical Nutritionist, and Doctor of Naturopathy. Thanks for tuning in with us again today. Talk to you about a common problem today, headaches, migraines. Huge problem. A significant portion of our society battles chronic migraines, chronic headaches on an ongoing basis. I'm going to talk to you a little bit about in this part one review that we'll do about some of the triggers, about some of the causes. Maybe in the part two broadcast we'll talk a little bit more about the potential remedies, the potential ways for you to deal with headaches and migraines. So let's just get right into it. Migraines, headaches, are they the same thing? Well, technically no. A lot of folks have they're prone to headaches on an ongoing basis, and they get low-grade, dull types of pain that can be frontal, that can be wraparound type headaches. They're tension headaches, but they're not migraines, where migraine is in many cases debilitating. I do not want to cover today whether it's with aura or without aura. Do you have a prodromal phase? I think from a practical aspect, I don't really know that you really care about that. I think I'm going to lump together headaches, migraines. I'm kind of going to lump them together and just get into the nuts and bolts, the meat and potatoes of what happens with migraines. Let's just start with the basics. Is there a vascular side? A vascular side would mean that there is a link to blood flow to the brain, or an impediment of blood flow. That could be a platelet issue. That could be sticky blood. And I know for those of you that have a medical background, it doesn't sound real technical or real medical, but most Americans have sticky blood, coagulative blood, because we eat a lot of deep fried foods, too much sugar, we eat a pro-inflammatory diet, we don't eat enough fruits and vegetables that have antioxidants, we don't take antioxidants enough, not enough of us take quality forms of omega-3 types of oils that keep our blood moving. So you can have a vascular side to this. You can certainly have a non-vascular side to headaches as a trigger and to migraines. Tension, stress, tumor. I mean, there can be very serious medical conditions and medical situations associated. So I would suggest to you that if you suffer from chronic headaches and migraines, the first thing that you need to do certainly is to see a primary care. Secondarily, see a neurologist to rule out a medical aspect. God forbid a tumor. God forbid some other underlying neurologic type of issue. When you've ruled all that out, then I think you have to take a more holistic, a more naturopathic approach, certainly. Let's talk about even triggers such as temporomandibular joint disorder, or TMJ disorder can be a trigger. I want to definitely talk a little bit about how stress is a trigger, how the cervical area and chiropractic and physical therapy would be able to talk to you in this area, how folks that are under chronic levels of duress and stress, there's a tremendous amount of muscle tightening and muscle tension that is put on to the base of the skull and the atlas area. The upper cervical, we know that we carry a lot of our stress from our mid-back up to the base of our skull, to the upper cervical, to the atlas region. And with that stress comes a lot of a natural physiologic responses for the musculature to tighten or to contract. When it contracts, it can pull. Poor posture can play a role here as well. So just from a functional standpoint, you can see there can be a vascular side, a blood flow, a procoagulative side. There can be a tension and distress scenario that leads to this. You could have something very medically seriously wrong, such as a tumor or a neurologic type of issue to the brain that can be a trigger, and all the way down to even something as simple as TMJ. Certainly, I think that the other area that we have to consider, Len's just done a series on neurotransmitter and brain neurotransmitter functioning, and we encourage you to go through and look at the other teachings that we've done here, everything from vitamin D to the one that Len just completed on neurotransmitter functioning. There can be a neurotransmitter side to this. There can be a brain neurotransmitter situation. We know that with a neuronal disorder, you will release substance P. Substance P is all involved in the pain mechanism and in the pain response. And with that, substance P encourages release of a lot of certain types of inflammatory proteins that are problematic for you. Those pro-inflammatory proteins can certainly create lots of issues and be another trigger. Let's move on in this first series, this first part on headaches, and let's talk a little bit about foods. No doubt that foods can be a trigger. MSG-related types of foods and compounds are a huge, huge trigger. Many times if you just get an individual's diet clean, free of a lot of processed, pre-packaged, manufactured foods that contain a lot of MSG or MSG derivatives. Now remember, MSG can masquerade in food products or processed food such as hydrolyzed proteins, hydrolyzed protein starches. There are huge hidden areas of MSG. It many times just does not come right out and say, I have MSG, or in the ingredient sections, monosodium glutamate. But you have a lot of compounds or foodstuffs that actually have MSG as a huge percentage of that legally FDA ruling does not mandate that they list it. We've got to be aware of what we consume. Sulfites, we know that red wine for many folks is a trigger, foods that contain sulfites. So I keep going through this battery and this list in this first section talking about triggers. I think the real goal is what do we do about it, and we certainly will get there. Serotonin deficiencies have been proposed as another potential deficiency disorder. This is why in many cases folks, physicians will prescribe pharmaceutical products that raise serotonin, not production, but keep more serotonin in the synaptic cleft so that there's more serotonin available. And in some cases, it's helpful. Len and I would take a little different approach to that as opposed to using a pharmaceutical. So what we've covered so far, everything from TMJ as a trigger to something structurally, something medical, to your posture, the tension and stress of a day. We have many folks that they wake up fine, and as they get into the body of their workday, with increasing levels of duress and stress that demands in the workplace or in a relationship, their tendency for headaches, etc., continue to escalate. The other area that we've discussed in recent teachings has to do with hormonal imbalances. Now, hormonal imbalance can be significant for women, especially with premenstrual types of syndromes. Premenstrual syndromes can be a huge issue and a huge trigger for headaches and migraines. We know many women that suffer from headaches, from severe headaches, migraines, very much prior or just prior to their menses beginning. There is a hormonal constituency here. There can be a dominance of estrogen and or testosterone, a deficiency of progesterone. There can be poor metabolism through the liver. The liver's not handling effectively. You're not breaking down your estrogen metabolites effectively. You're not excreting them. You have an estrogen-dominant state, encouraging fluid retention and also then in many cases, headaches and migraines. So we know now that hormones certainly can be an issue in many cases. We've talked about tension. We've talked about stress. Adrenal stress can be a huge trigger. Now, I want to talk to you about one last area. Now, certainly this is not all-encompassing, but mitochondrial energy deficits have certainly cropped up in the last 5 to 7 years as another issue. Hence, some of the studies that you see that have been done have utilized nutrients such as riboflavin, magnesium, coenzyme Q10, B6. These nutrients are cellular energizers. So mitochondrial deficits, serotonin deficiencies are also linked. Say serotonin deficiency, how do I know if I have that? Can I have a blood lab that tests that? Not really. You can do some neurotransmitter testing that would be indicative and give you an idea. But in this setting, what we're going to talk about, as we've talked about today, are many of the triggers. In the next part 2, headaches/migraines part 2, we'll talk more about what your approaches are and what you can do. Stay tuned for part 2. Thank you.